To our newly appointed President, good day. My name is Castro.
I am Erica C. Dubal.
And I am Nicole Alisa Pajarillo.
In behalf of all the nurses here in the Philippines,
we would like to present
the BSN vision of healthcare.
Here are some of the success stories from countries that practices this technology.
The opportunity with better data management is enormous.
Moving towards better use of open standards, better sharing of data, actually at the very top level allows us to really understand how the health service is operating.
We have a chance to do things differently. And so what we have is we've huge inequalities within one system. We can't even find those pockets because we don't have enough information about the patients. We need to advance the national conversation around what's being used with data, what's going to happen with data, how a patient's data is being used for their direct care and for secondary uses. And then for the workforce, it's really important that we bring about change programs and digital transformation that helps them to do their job better. Because it's not about digitizing what they're doing now, it's about making technology a seamless part of what they're doing now.
It will be a generational shift. I think new clinicians coming through the system will just expect to have the latest and greatest tools and be able to interact with them.
Dr. Simon Eccles, the NHS CCIO, said recently that artificial intelligence will enable doctors to be more human and to deliver care better. And so it's about developing technology that doesn't absorb lots of clinical time. So for me as a doctor, you spend so much time with multiple logins and just wasting time, when instead that should be with the patient and with the rest of the healthcare team in order to discuss, well, what are we going to do and how are we going to do it?
But I think, we're talking about the generational shift, from my personal perspective, so take my data so I don't have to answer the same questions 5 times when I go into hospital. But actually, I insist on that data being used to further research in the UK and to benefit other people and use it more effectively.
Over 80% of the patients feel they should be able to access their own health data. And if I was to tell you that you had to go back to a situation whereby I'll give you your bank balance every quarter in a paper statement, you wouldn't stand for that. But at the moment, that's what you're putting up with as a patient. The opportunity with better data management is enormous. We have a chance to do things differently if we build the proper foundation of data. And so I'm enormously excited about the chances that we have if we can bring this together and do it properly.
The nursing minimum data set represents the first attempt to standardize the collection of essential nursing data. This minimum core data, used on a regular basis by the majority of nurses in the delivery of care across settings, can provide an accurate description of nursing diagnosis, nursing care, and nursing resources used.
Collected on an ongoing basis, a standardized nursing database will enable nurses to compare data across populations, settings, geographic areas, and time. Public health nurses will be able to evaluate and compare services.
The Nursing Minimum Data Set, or NMDS, is a classification system which allows for the standardized collection of essential nursing data. The collected data are meant to provide an accurate description of the nursing process used when providing nursing care.
The purpose of using NMDS allows the collection of nursing data, which helps to identify current trends, stimulate future research, and facilitate the allocation of funds. It also contributes in the documentation of various tasks nurses perform on a routine basis, which shows the effectiveness and value of care nurses provide. Here are some benefits of nursing minimum data set. First, access to comparable minimum nursing care and resources in local, regional, national, and international levels. Next, enhanced documentation of nursing care provided. Next, identification of trends related to patient or client problems and nursing care provided. Impetus to improve coming of nursing services. Improve data for quality assurance evaluation. Impetus to further development and refinement of NIS.
Next is comparative research on nursing care, including on research, nursing diagnosis, nursing interventions, nursing outcomes, intensity of nursing care, and referral to further nursing services. And lastly, contribution toward advancing nursing as a research-based discipline. In conclusion, nursing minimum data set helps to improve the quality of care. Imagine the Philippines having a high quality of care. Isn't it amazing to think that we are a third world country, yet our healthcare is a standard? Less mistake and less malpractices. More in good services and focused in improving the life of every patient. We, student nurses, and healthcare providers aren't the only organization to benefit from this, but also the client and the people all over the Philippines. Now that you have seen the unseen vision of nurses, we, the students, encourages you and your government to support our vision in taking this small step to reach our optimum goal. Thank you.